As we think about kind of there's the old adage, what gets measured gets managed. And I think employers today swim in like an ocean of irrelevant information. We're sort of, we're dying of thirst while swimming in the ocean of sorts with innovation, or not with innovation, but with insights. What are some of the key KPIs that you need to track in order to guide a health plan to great outcomes?
Yeah, that's a great point, and it's interesting that you say we're swimming in insights because I think it's we're swimming in data as opposed to insights, right? There's so
Please.
many metrics, and how do you think about what are the right metrics? And I use a framework, I've used it forever, that lays data alongside time, right? So some of this is about setting expectations internally, and and again, when you're thinking about starting small, you're not gonna get 100%, right? Can we move the needle 5%? And what's the potential impact of that? So, thinking rationally about what your goals are, and then understanding it in terms of what we think of as process, which is the how manys, right? And this is where a lot of places get stuck because they start there, and that's as far as they go. We had engagement, right? We had 37% sign up or whatever that is. So that's the how many's. The next layer, and you can get that pretty quick, right? You can get that within 30, 60, 90 days of doing something. The
Mhm.
next layer is attitude. What did people think of it? This is a little more challenging because in a lot of organizations, they don't want to do more surveys. Asking the question the right way really matters. Sitting and putting a question out to an employee population saying, "Well, what kind of benefits do you want?" You're likely to get everything that's not possible, and then
Yeah.
the message back is, "We didn't pay attention," right? So how you ask that question really matters. And then the next level is impact, which is what's happening to rates and, so PEPMs, yeah, think of average lengths of stay, right? Inpatient stays per thousand, like the rate stuff that you can start to understand a little bit more after maybe 9 to 12 months. And then what's the long-term play here? Are we really looking for trend reduction? Are we really looking for how does this impact our potential attraction to employees? Like there's all kinds of different layers, but you have to have a strong sense of priority about what matters. What are you trying to accomplish? And then work backwards from that.